Well, I'm Dr. Cato Laurencin. I'm an orthopedic surgeon and a biomedical engineer, and I work at the University of Connecticut. And as an orthopedic surgeon, I'm a knee and shoulder specialist. I work in taking care of problems of the knees and shoulders, and most of the work I do involves surgery. The surgery I do is called minimally invasive surgery, in which I perform something called arthroscopy, which is consists of making a couple of small poke holes in the knee or the shoulder, and with a small instrument I could look inside the knee and do all the surgery through that area. I chose orthopedic surgery because when I was in medical school at Harvard Medical School, it was just fun. It was a fun area, and so I decided to pursue that area. At the same time, I gained an interest in engineering, really starting in college at Princeton in chemical engineering, and then decided to combine them together in terms of my work, in terms of combining engineering and medicine. I became inspired to become an orthopedic surgeon probably from a number of different people. Obviously, my parents were very important. My mom was a primary care doctor. My dad was a carpenter. Some people think that combined makes me suited to be an orthopedic surgeon because we use drills and hammers. But also I had a number of people, a number of mentors during medical school who were involved in clinical work and involved in research, and I just liked what they were doing, and I wanted to do what they were doing. I grew up in Philadelphia, North Philadelphia, in the inner city. I went to public high school there. From there I went to Princeton. I studied chemical engineering. I didn't know much about chemical engineering, but again, I had some great mentors who were there who helped to guide me along the way, and started to study chemical engineering. When I finished, I was always going to be a doctor. I went to Harvard Medical School. I started to be in the Harvard MD MPP program. I was going to do a master's in public policy, but then decided to revisit my research roots and my science roots, and then met someone named Robert Langer at MIT, and decided to work with him because he was just a fantastic mentor, and then did my MD and my PhD. I've got a great family with a wonderful wife and 3 great kids, and they're not quite sure if they're interested in what they're going to be going into, but all have some interest in science. Outside of my practice, and outside of my research, my main hobby is actually golf. I'm a big golfer. I'm not a good golfer, but I'm a big golfer, and I'm really proud to be the keynote speaker for the event this year. It's very impressive to see the hundreds of students who have come here in Florida to learn about and be mentored about careers in the health sciences, and I'm especially grateful and honored that there was such a positive response from the students in terms of my talk. So I think that the health sciences is still a fantastic area to go into, and especially careers in medicine are abundant, and there's actually a shortage of physicians in America right now, and there'll be a shortage for the next 20 to 30 years, so there are a lot of opportunities to be able to go into medicine. For students at any age who are interested in going, I've talked about the 4 M's that are important in terms of being able to develop to the next level. The first M is me, or develop yourself, or you. Develop who you are and to move to the next level. That means working hard, making sure you're smart, being a good person, showing courage, and showing adaptability in terms of your life and your career. Developing mentors, which is the second M, is very, very important, and mentors are so key to the career, and telling students, letting them know at an early age how important it is to find mentors, and multiple mentors to help one in their career and life is important. And then my third M is money, and I think I use that third M because I think that young people are considering how they're going to be able to pay for things in life, and a number of decisions are made involving what the pay structure is. And medicine is still an area that pays very, very well, and it's important really to let young people know that this is an area that people can do well financially and can succeed. But being able to succeed really depends upon their getting a great education and doing well with their education. And if they work hard and do well in their education, really the money issues and money questions will take care of themselves. And the last area is sort of managing life and managing principles for life. And those include the fact that one should be optimistic about life every day and take on challenges as opportunities. Taking chances is key. People who are successful are people who take chances. I have a friend, Mr. Curtis Robinson in Hartford, Connecticut, who says 99% of people in America don't take chances, and the other 1% own everything. And I don't quite agree with him. I don't think that's the percentage, but he's right that those who do take chances in life, reasonable chances in life, can be very, very successful. And the last take-home point is that having courage and making courageous decisions through your life, and also having resiliency and adaptability to different settings, is really key, a really key area. But finally, I think that the message I wanted to give to all the students there, that every student in that room can become a physician if they want to. They can have any career in health sciences if they want to, if they follow some of the keys to be successful in life. I greatly enjoyed my time here in Florida, working with the National Medical Association local affiliate, and look forward to further interactions here in Palm Beach.